I'm actually from ISEC. I'm an eye doctor, and my specialty is in cataract and retinal disease. Now, diabetes is a very common condition, and in Malaysia, roughly 1 in 5 people has diabetes. That means that if we have got 100 people standing here, randomly about 20 of you would have diabetes. Either you know about it or you do not know about it. That means that translates into quite a number of patients, all right, in the community to have diabetes, okay? And again, you can see that the incidence of diabetes increase with age. That means that if you are older, if you are 40, 50, or 60s, you are more likely, right, to get diabetes. If you are 60 years and above, up to 40% of you will have some form of diabetes, all right? So this is very important for you to understand. Now, diabetes is not a condition that affects only a certain part of the body. It affects the whole body from the brain to your toes, all right? Because it's a condition where the blood sugar in your body is abnormally high. We have high and low blood sugar, depends on whether you have eaten something and then you process it. But in a person with diabetes, the metabolism of sugar is abnormal. And because of that, it can cause a lot of damage to different parts of the body because the whole body has blood vessels. It damages the blood vessels in the long run. Okay,
So if we feel a bit symptom with our eyes, does it mean that our diabetes is in a later stage?
well, basically, if you have diabetes, you can have damage to the eye, all right, because it's part of organ that's damaged, especially in the inside of the eye called retina. But it can change the whole thing in the eye, all right? Everything can be abnormal. Yes, the more severe your diabetes or the longer you have diabetes, the more likely you have eye problems and vision problem. If you are diabetic compared to a non-diabetic patient, you are 25 times more likely to get blindness compared to non-diabetic. Not 2 times, 25, 25 倍, 25 kali ganda.
So which means that if we feel something wrong with our eyes, we need to take some action very quickly.
Yeah, if you are diabetic and you never seen an eye doctor, today you better make an appointment to see an eye doctor, right? You may not have a problem, but chances are you may have some problem in your eye and you may not realize it. By the time you realize something, it may be, well, may not be too late, but it's not desirable.
Maybe a bit late.
Yeah. Okay, if you see that how many people, I'm from the eye doctor, so I look at eye perspective, all right? You are quite familiar, diabetes, they have flow problem, their leg get amputated, right? Heart disease, stroke, everything. From the eye point of view, a lot of patients with diabetes are not aware of the effect on their eye. If you look at the feeling about what, if you just do a survey of diabetic patient, what do you think can get have a problem? About 65% says, yeah, I may get some problem, but I don't think it happen to me, all right? So they have a positive thinking, but this is a fatalistic thinking, all right? But if they know they have a problem, I say that I tell you, you have all these conditions, all right? What are you most concerned about? 50% of them are more concerned that, you mean I can go blind? That's my number one concern. That even outweighs you have a higher risk of heart attack. So they said, not so scared. I'm scared that I'm blind. So
I think
blindness.
I'm also scared of one day wake up, I can't see anything.
Yeah, I suppose if you're knocked out from a heart attack, you go means you went, all right? If you're blind, I think you'll suffer, right? Not just you suffer, your family, your caregiver will suffer with you, all right? Can you imagine? Basic function, to go to the toilet, you can't do it, yep. Somebody has to clean up for you. And now, because it's an eye talk, I'm going to just roughly say this is a schematic diagram of the eye from the front to the back. Diabetes can cause all the changes in the eye, all right? But I'm going to concentrate on things that are very important first, okay? Sorry, this is not working very well.
So we can go to the next slide.
Next slide, please. Okay. Now, let's start from the front to the back. If you are diabetic, your blood sugar level is always high. You are more likely to get infection in your lids. Yeah? Your lids will get what I call blepharitis. You tend to have a sty formation, all right? And your eye will feel very uncomfortable, gritty because a lot of inflammation on your eyelid. Yeah? Your eyelid become very red and etc. And also sometimes you get a exacerbated dry eye syndrome dry eye syndrome symptoms. Now, somebody have to forward the slide for me. Next one, please. Okay, you are also more likely to get glaucoma, all right? Because what happens in diabetes, all right? Let me see whether I skip any. Okay, then I'll come back to that. Your cornea first, all right? Your cornea, which is the part where you put your contact lens on, all right, will lose sensation, all right? Because diabetes, one of the effects is that your sensation in the eye is blunted, and sometimes you get micro scratches on the eye, you are not that aware, and it's easily get infection, and you get corneal ulcer, all right? Means pus would form on the surface, especially if you're a contact lens wearer. Because diabetes affect blood vessels are blocked or damaged inside the eye, especially small blood vessels. That would cause a blood flow problem to the eye. And your eye gets oxygen and nutrients from the blood vessels, all right? So when you have a starvation of oxygen because they're not flowing, you are more likely to get glaucoma, where it's a condition where the eye pressure in the eye is higher than normal, and that is also blinding. Now, if you have blood sugar going up and down, you may see that your vision, even if you have no other complication, would change in the focusing, all right? Because sugar is concentrated in the eye, right? If you're very high concentration, you have one focus, low concentration, another focus. So you don't seem to be able to have a stable power, all right? That is also a common condition, all right? Changes in refractive power.
So like if you feel blur a while, then clear a while, so it means it's a symptom
It
of
could
diabetes.
be, yeah, all right?
So we have the next slide.
Next slide, please. And one of the commonest thing that can happen to every one of us is the formation of cataract, all right? Cataract means the lens in the eye. This is a dilated pupil. Normally it's transparent, just like our lens should be transparent. But if we become not so young, all right, especially 50, 60 years old, our lens become opaque, all right? That is called cataract, 白内障, all right? In a diabetic patient, of course, you also get old, you can get cataract, but you are more likely to get cataract earlier, all right? If a young person with diabetes, they are 4 times more likely to get cataract compared to a young person without diabetes. And the older people, of course, you get diabetes, but they are twice more likely to get more mature cataract. Now, all those are general things that can happen, but a specific thing that can happen to a diabetic patient is in the retina, all right? And when that happens, you can lose vision, and some of them very hard to treat. That condition is called diabetic retinopathy, all right? It's a problem in the retina. Okay, this is just a classification for us, all right? Because retinopathy can progress from very, very mild stages to very severe stages. So for us, doctors, we would try to classify that, all right?
So this is irreversible.
It is, in early stages, generally are reversible. But if you are very, very damaged, sometimes you will lose the eye. We lose the vision, all right? Now, how likely are you, if you are a diabetic patient, if we take a random again, all the diabetic patients, let's say we are all diabetic, we check your eye. Any one time, 1 out of 3 of you would have some form of retinopathy in the eye, okay? So in this graph here, 35% would be any form of retinopathy, all right? So the PDR, the bottom one, are the more severe forms. So about, of the 35%, probably another 20% of that patient, all right, would have a very severe form. In the world, that translates into almost 100 million people now walking around, all right, have got some form of retinal disease. So it is quite common. Okay, what are the risk factors for diabetic retinopathy? Obviously, the duration and the control of diabetes, okay? So the top 2 is the most common. So this is something you can't stop the duration. If you are diabetic, you are probably diabetic for the rest of your life, okay? But at least you can control the sugar level, all right? This is something you can do to stop the progression. If you have other diseases concurrently with your diabetes, you are more likely to get a problem, all right? Especially high blood pressure. Again, you can control that. If your kidneys start to fail from diabetes, bad news, more likely to get eye problem, all right? If you smoke, you probably can cut down already. Other thing you may or may not be able to control effectively is your weight, all right? If you can reduce your weight, it's good for diabetic control, all right? And indirectly also helps you. Okay, so what is the big deal? Like mentioned before, the high level of blood sugar in an abnormal fashion would damage small blood vessels, right? We have the retina is actually a layer at the inside of the eye that function like a nerve, film in the camera. It's called retina. Has plenty of small little blood vessels we call capillaries. Those blood vessels are the most susceptible, easy to be damaged by blood sugar. When you have a damage there, either the blood vessels get blocked, just like pipe all get blocked, so no flow, or the blood vessels become very fragile and they burst or leak. All right. Also like pipe, they leak out all the content, the blood. Okay, where's the retina? Right. You see this is the front of the eye. You see this orange layer that lines the inside the eye. The whole layer is called the retina. All right. This is like sensor, and you can see that there's a moon-shaped like thing that is called optic disc. Optic nerve head is where all the blood vessels will come out and branch out from there. So basically, to enter the eyeball, all right, the main supply of the blood enters through that, all right, inside of the retina, and then it starts to spread and supply the whole retina from there. So if you have blockage there, you got trouble in your vision, all right? Okay, so this is what the eye doctors see if looking into the eye, a dilated exam. The retina looks like that, okay? The center part, the brown color, is called the macula, which is the most important spot because you use that to see fine vision. It's smack in the center. That's why when you look at a beautiful person's face, you use your center. From the side, I know you are there. I can't see how you are, all right? Same when you read. Chinese call huang ban, all right? That's why I say yellow spot. If you have a huang ban bing, means that the spot there is not normal, all right? But you can see what happens when you have diabetes is that, okay, if you are very mild, you may not see very well, but let's see some more severe cases. You can see that there are a lot of all these flame-shaped blood patches, right? Basically, these are all the leakages, burst, right, blood vessels, and that have happened to your little blood vessels there, right? So it's a progression from a bit of bleeding spot to more spot. And over there, you can see some yellow spots there, right? That near the macular region, those are actually proteins and fats that leak from inside of your blood vessels. Because our blood vessel doesn't only carry red blood cells. It has got liquid that contains blood and all the fats and we call plasma. In the more severe cases, because the blood flow has disrupted, there's less oxygen inside the eye. And the body will, the eye will produce a factor, a growth factor that is abnormal. We call VEGF, vascular endothelial growth factor. And that growth factor would promote abnormal growth of new blood vessels, right? Basically, if fool the eye, say that there's no oxygen, let's grow some blood vessels. You can see that all these little squiggly line are abnormal blood vessels that branch off from the normal blood vessels. And these are the ones that cause a lot of problem. All right, these blood vessels are like your wheat on a lalang, on a padang. You know, all these will grow without haphazardly, abnormal, and they tend to bleed. There's one big bleeding patch there, and they scar up. All right, so this is how you lose vision. All right, the retina is damaged. Okay, you can see that. Very abnormal now, a lot of distortion there because the blood vessels start to grow. It's just like your well-manicured lawn, beautiful green, but you went for holiday 5 years, never look after your lawn, you come back, what's happened to my lawn? It become a blue car, right? Everything is haphazard. And then in this here is that although it eventually will enter a quiet phase, but it will cause a lot of scarring there. You can see all the scar, the whitish. So your retina get distorted and damaged. So we don't want you to have this problem. Now, sometimes you may not have a lot of blood vessels that grow. You get massive leakage, all right? Leakage from the blood vessels. And you can see all these yellow spots. I told you the protein, the fats all will leak out. And because the eye is not flat, the eye is like a bowl, right? So this is just a flat picture, but the lowest part, all right, in the eye is where I told you the macular huangpan. So everything would track underneath, just like your Milo, right? Coffee, everything would settle down. So it always invariably settle behind here, okay? And all these fat clumps and all those, again, accumulate there, would damage your center vision, all right? So we call that macular edema. The macula got swollen, all right? This is also very common, all right? So basically, so that is how your eye get damaged. So you should have your eye examined. That's why when I say that if you are diabetic, never see an eye doctor, you better get yourself examined. Now, most of us are adult type diabetes. So at the diagnosis, you should start to schedule. I don't think it's an emergency. You don't have to, after my talk, say, okay, I must go to A&E and have my eye. No, schedule it in the next few weeks, no, because we want to check your eye, all right? Why? Because even though you say, I just been diagnosed diabetes last month, I think you better schedule. Why? Because are you very certain that you only had diabetes for 1 month? No, most of us had in adult onset may have diabetes for a few months to few years, but because it has no symptoms that you did not know that you have diabetes. So it has been there probably in your body for a while. That's why it's best to examine, all right? Of course, there are one type which is in young children onset, all right? That one, we are quite certain that they couldn't have like diabetes for 20 years before, right? Because if you are 4 years old, maximum, all right, you only have it 4 years. And we know that that type of patient, we are quite certain when is the onset. Because if you do not have, you have diabetes for a long time, they probably have very sick already. So that one you can wait for a few years. But adult one, we don't know how you are, how long you have to examination when you are diagnosed. Now the other one, that's because we are getting a lot more diabetic in younger and younger adults. A lot of people who have diabetes, especially female, are at a fertile age. Means they are capable of getting pregnant. If you are a diabetic patient and you plan to get on pregnant, you can. It's a high-risk pregnancy. You must talk to your OBGYN, obstetrician, and also get your eye check, all right? If you are diabetic, not well controlled, pregnant, bad news, all right? Even if your baby survive, you may lose your eye, okay? I've seen quite a number, not so common now because of education and internet, all right? People will come within 3 months to 6 months from a normal looking eye to totally non-salvageable because the hormonal change in your body accelerate all the problems. So they can progress rapidly. So you have to control your sugar well before you contemplate pregnancy. All right, that is important. Okay, so right, you know you have this problem. You are aware now, and you have gone for tests, and doctors say, okay, you have a problem. So what can we do? All right, obviously we have to do something. If you have no treatment, what's the point of talking here, right? Right, just say bye bye. You have diabetes, go back. No. If you have got, we are at least 3 ways we do that. The middle one where we do an injection into the eye to counter the factors that I told you that's grown for the eye is probably the commonest because most people have moderate amount, they have leakage from the retina and cause vision loss. Those can be effectively countered by just injecting into the eye. Sounds scary, injecting into the eye, all right, the medicine, but of course, 2025 already, right? We have anesthesia. We numb your eye, you don't feel a thing. We inject, you don't feel a thing, all right? So basically, that is something that we can do. But you have to maintain a schedule because diabetes is a long-term thing. It's not one-off. It's not like you're having a flu goutim. 1 week later, I'm back to normal again, all right? Diabetes linger on with you. The effect on your eye also doesn't disappear with only one injection. It may take up to a year before it settles. So you have to come back for repeated injection. But 80 to 90% of people who have injections, actually they respond very well and vision can actually go back to quite normal if we do it regularly and timely. But sometimes I told you they have got abnormal blood vessels, they start to bleed a lot inside the eye, scarring, you need surgery, all right? But in the old days, we do a lot more laser treatment where we actually try to destroy all the abnormal areas, all right? This is the eye. You can see diabetes, there's blood there. You can see all those little black and white scar, like cobblestone. Those are laser spots. We use laser, a bright light, to shine and burn off all the abnormal area, all right? Sounds crude, but very effective, all right? So, but why you say that after burning off my retina, can I see? You can still see because we spare the center part. You can see the center part near the macula is not burned. We sacrifice some at the side vision, all right? Because most important is still my center vision. Who cares if I lose some vision here, here, and here, all right? So sometimes, like any strategy, you are willing to give up some for a lot more, all right? You can never win all the time. Whoever win all the time here is not realistic, all
We
right?
secure our front vision.
Yep, correct. So that's why most doctors are very pragmatic, all right? What we can, what we cannot do, we say, okay, this one we sacrifice. Next. Next slide, please. Okay, just now I told you the injection. That's a schematic. We inject a medicine, all right? The liquid go inside, and that medicine would go to the target area and has effect to stop the leaking, the burst blood vessels from its target, all right? So why we have to inject? Because we can't deliver the medicine satisfactorily to the target area. The easiest is to load it inside where you are. Just like if you want to bomb KL, I put the bomb in KL and not PJ and hopefully it spill over here, right? Bomb KL, right? Okay, so I think that when you have, see, you can't see very much of the retina because what happened is there's a lot of blood inside. The eyeball is a ball, literally, right? When your blood vessel, retina at the back of the eye start to bleed, the whole thing just full of blood. So that's why people lose vision or a lot of scarring there. This, you need surgery. You need to clear all these things, all right? So surgery means that you have to cut away all these things. You have to suck out all these things, all right? So that's why surgery is another option. Sometimes you have to do a combination. Okay, so basically how does the symptom, let's say if you can't focus, you start to have patchy vision, right? You lost some vision, things are distorted, all right? These are all common vision, and or things are like, contrast is no good, all right? They are probably a symptom of retinal disease. And sometimes you can test yourself looking at grid. Easiest is look at some of your tiles in your bathroom or whatever. Every day you sit in your toilet, you look at the same place. Hey, how come today something is gone? All right? It is a warning to you, all right? You must always shut your eyes, test each individually, all right? Because if you open both eyes, sometimes one eye is gone, you don't know. The other one compensate, all right? So a lot of people, they say that, hey, I didn't realize I cannot see until I close one eye, okay? So you can do that. And of course, optician and optometrists and eye doctors use a chart to see how well you can see, all right? If you do not reach a certain line, means that you didn't reach the standard, we are concerned. Because everybody got standard vision, all right? Okay, so basically you can see that if you are normal, this is just illustrative, you can't see from here. Most people can see almost near the bottom, all right? You may say, I can read at the bottom. Then you know you have standard vision. But you start to say, I can see, but I start to lose. I can see only 1 or 2 lines on top. You are way from standard, right? Just like, for example, I say, if I can run, from here to there without breathless, I walk 2 steps, I get breathless, I'm not standard already, right? So something not wrong. Eye also, you have a standard you can see, all right? So this is why we always insist that before you see eye doctor, we see what's the level of vision. If you are seeing well, at least we are not so worried, yeah? But of course, sometimes you need glasses to see well. Next. Okay, so as a patient, what can you do, all right? You have to remember this track, all right? You can take your medication and take control of diabetes. This is what you can do for yourself, all right? And you must have target, because one of the biggest problems why we have so many people in Malaysia with diabetes is look at our food, yeah? Look at our lifestyle, right? Bubble tea, 100% sugar.
Nasi lemak.
And BMI, right? Very few, very skinny people here anymore, right? More chubby and chubby. I saw a double chin already, right? And then we hardly do exercise. Say, why exercise? No, walk only lah. Walk to work. That's my exercise, right? Again, all this you can do. Add some physical activity. I told you, control whatever is controllable. And if you're a smoker, you kick the smoking habit, all right? Because all this add to blood vessel problem. Okay, so basically, I think more important today is that you understand what's going on. And then the last one is that if you're not seen an eye care practitioner, you have to probably do. I just show you some example, right? Always people want to see pictures and talk. And okay, next please. Okay, just now I told you, right? Picture of a retina, but this one, obviously you can see a lot of little spot of bleeding here and there. Those yellow thing, you can see that abnormal here, something broke, and the fats, all those come up from there, all right? You can see actually radiates out, all right? So this is very typical. You have got excellent vision now, with this. Because the eye is like only patchy damage. Because you see, when we look at you, all right, our brain synthesizes the image. If I lost a bit of image here, your brain covers it up. All right, so we have remarkable ability to smoothen out things.
So you imagine the.
Yes, it's a processor here, right? So you'll never know. That's why it's very hard to say that I can see changes. One, don't worry, no, you see eye doctor. Okay, good luck to you. All right, next. Okay, so more example, because as become more severe, the splitting spot get more and more. Next, please. We go through this. All right. Here you can see more and small spots, and sometimes you get what's this? All this fluffy, slightly different from all those more discrete yellow. These are actually we call cotton wool spot. Right. These cotton wool spots there are actually a local swelling of the retina because at that site the blood vessels get blocked. Initially, when it blocked, no oxygen, they become swollen up. When it's swollen up, become yellowish. All right. Next, you can see that more severe, more heavy spot. Here maybe you start to say vision not so good. Why? I told you the macula is here, right? The macula is start to be affected by all this deposit. So basically, you have to wait until your center vision is compromised. Then you probably would notice things because you lose a bit vision left and right here. You don't know one. All right. Okay, here, more severe cases when you start to have abnormal blood vessels growing here and patches of blood leaking out, all right? That means that the eye is truly very starved of oxygen. The eye start to compensate, making blood vessels inside there. We call these new vessels, abnormal vessels. They are not supposed to be there. And all these vessels start to bleed. Now a small patch, maybe 1 or 2 black spot here, but once it bleed more, you lose vision. Next. All right, you can see more. You can see all these abnormal vessels that grow everywhere. It's distorted. Next. And then bleed all over. All right, can't see. Very blur. Okay, so basically, I hope the take-home message is very clear. Diabetes, to recap, 1 in 5 in Malaysia because of lifestyle changes, lack of activity, obesity, you name it. All right. That means that at any one time, 20 out of 100 people may have diabetes. And if we take the 20 people, we look at it, all right, at any one time, 35% of that 20 people has got changes in the eye already, right? Diabetic changes. So that's why it's important. Even if not you, your father, your uncle, your family, whoever, say, hey, I think you should have an eye examination, all right? At least once you entered a program, all right, the doctor will say, okay, so far so good, I'll see you once a year, so you make an appointment. Or if you have early changes, I say we will change. I say, nope, no treatment yet, control your sugar. Let me see you again in 4 months to 6 months' time to see how they are. So at least you are in a monitoring program. Okay, so the first thing is to realize. And then just now, a lot of education on what can happen. The main effect is in the retina. All right, this is because it is usually quite devastating to vision. But if you are able to be picked up early, offered the appropriate treatment early, and do whatever is necessary early, you are not likely to go blind, all right? And blindness is real. You are 25 times more likely to go blind if you are diabetic compared to non-diabetic patient. And by far, is still the commonest acquired blindness in adult today. Thank you.
So thank you, Dr. Wong, for his sharing. So we get more insight about diabetes and the relation with the vision health.